Hi everyone, welcome back to SG Dr. Wellness. My name is Dr. Chen Yiming. I will be sharing more about a very common condition in my practice called irritable bowel syndrome. Have you heard of this condition? And how do we diagnose it? Is it a dangerous or serious condition? Watch till the end to learn all about it. Click on the subscribe button if you are new to our channel. Irritable bowel syndrome or IBS is a functional disorder affecting mainly the large intestine. When we refer to a functional disorder, we are saying that your intestines are not functioning like it should in the absence of a serious medical condition. You can think of it simply as a malfunction. The symptoms of irritable bowel syndrome are so varied from individual to individual, but they do last a long time, usually for months, even years. Some of the symptoms include abdominal pain or cramps, diarrhea or constipation or a mix of the two, abdominal bloatedness or distension, mucus in the stool, a sense of incomplete evacuation after passing motion. Now, I'm sure many of you watching the video now will go, "Hey, I do have those symptoms. Maybe I have irritable bowel syndrome." But stop right there. Before we make a diagnosis of IBS, we must make sure that your symptoms are not caused by a serious medical condition like colorectal cancer, inflammatory bowel disease like Crohn's or ulcerative colitis, diverticular disease, or other colon infective disorders. If you do have symptoms like loss of appetite and loss of weight, blood in your stool, iron deficient anemia, difficulty swallowing or pain in swallowing, persistent abdominal pain that is not relieved by passing gas or bowel movement, then please see your doctor urgently for further checks to ensure that this is not a serious medical condition. Some of the tests that your surgeon or gastroenterologist may do to exclude all the serious conditions include colonoscopy, CT scan or MRI scan of the intestines, blood tests like full blood count. So once we can exclude the possibilities of the serious conditions, we can start to then make a diagnosis for IBS. The diagnostic criteria is based on the Rome criteria, where the patient has recurrent abdominal pain on average of at least 1 day per week in the last 3 months, associated with 2 or more of the following. The pain is related to defecation, meaning pain is relieved by defecation or pain may be worsened by defecation, change in the frequency of the stool, and change in the form and appearance of the stool. Risk factors of IBS includes a young age. IBS occurs more frequently in people under 50. Females, IBS are more common among females. Positive family history of IBS. You have a higher risk of IBS if you do have a family history of it. Psychiatric or mental conditions increases your risk of having IBS. And finally, stress. The exact cause of IBS is still not known. People with IBS appear to have extra sensitive muscles and nerves in the bowel. The muscles may contract too much when you eat, causing abdominal cramps. In some cases, food may be forced through your bowel more quickly, causing diarrhea during or shortly after meals. In others, food passes slowly through the bowel, causing hard stools and constipation. There are also cases of IBS that comes on following an intestinal infection by bacteria or virus. Unfortunately, there is no specific cure for irritable bowel syndrome. The treatment for IBS focuses on the treatment of symptoms and the management of the stressors that triggers the symptoms. Some of the medications that we often give to control symptoms includes laxatives for constipation, anti-diarrhea medications for diarrhea, antispasmodic for intestinal colics, sometimes even painkillers. You have to manage your stress by sleeping early, getting enough sleep, meditation, and adequate exercise to bring up the happy hormones. You may need to avoid certain type of food that may trigger your symptoms like alcohol, spicy and acidic food, chocolate and caffeinated drinks like coffee and soda, breaking your meals up into 4 to 5 small meals, ensuring adequate fruits and vegetables to avoid constipation. You may have to come up with your own customized solution for your irritable bowel syndrome. Thank you for watching till the end. I hope that this video can provide some insights into your condition. Subscribe, like, and share this video if it's of any value to you and your loved ones. So till the next time, stay safe and stay healthy.